This conference will now be recorded.
Hello, everyone. Welcome and thank you for joining us for today's ACRM pandemic webinar, which is part of a series of webinars produced by ACRM and the ACRM Technology Networking Group to help bring needed information to rehabilitation researchers and providers regarding the use of telehealth during the pandemic. Today's webinar was produced in collaboration with an international networking group and specifically with the Service Delivery Task Force of the International Networking Group. My name is Pofi Constantinidou, and I'm the chair of the ACRM International Networking Group. The topic for today's webinar is Rehabilitation Services of Latin America in the COVID-19 pandemic, Attention to Special Populations, and will be presented by Melina Longoni Giusto, MD, Director of Disability Department of Ituzaingó, Buenos Aires. She's also Director of ReDel, Rehabilitation Center in Tigre, Buenos Aires. A few housekeeping items before we get started with the presentation. I do want to advise that this meeting is being recorded. I'd like to ask all attendees to keep your phones or mics muted and keep your cameras turned off throughout the presentation. We do expect to have about 20 minutes available for discussion at the end of the webinar. So if you have questions, please type them in the chat feature and we will address as many of those as we can during the last part of the hour. Now it is my great pleasure to introduce our guest speaker, Dr. Melina Longoni Giusto. She specializes in physical medicine and rehabilitation. She has a hyperbaric medicine specialist diploma in wound care and university expert in natural therapies. She's medical director of the ReDel Rehabilitation Center in Tigre, Buenos Aires. She's Director of Disability of the Municipality of Ituzaingó, Ministry of Health, Buenos Aires. She's Scientific Advisor of B. Braun Medical, Argentina, Professor of the Diploma in Wound Care of the Argentine Interdisciplinary Association of Wound Healing, and at the Open University, or UAI, in Buenos Aires. She also holds the secretary position for the Argentine Interdisciplinary Association of Wound Healing between 2019 and 2021. She wears many hats. She's also president of the AMLA-RES, the Latin American Medical Rehabilitation Association residents. She's member of the Latin American Committee for Rehabilitation Research, or CLAGIR, and she's member of the Americas Committee of Asia, the American Spinal Injury Association. Dr. Longoni, we look forward to your talk and will now turn the presentation over to you.
Thank you so much for this opportunity. Thank you, Fofi, for your presentation. This is a great opportunity for me and an honor to share with all of you our experience in Latin America. As you said before, the title of my presentation is Rehabilitation Services of Latin America during the COVID-19 pandemic, Attention to Special Populations. The topic of my discussion today is the result of a work that we started in Latin America when COVID entered our countries. First of all, I want to say that I have no conflict of interest. And I would like to thank all the people who collaborated in some way, directly or indirectly, to this presentation. So in this talk, I would like to cover a few issues. First, to learn and discuss opportunities and barriers when working in rehabilitation and within low-resource settings, to provide an update overview of guidelines for COVID-19 care based on data collected and compared across 19 countries in Latin America, to outline considerations on how to work with spinal cord injury population during the pandemic, to learn how to work with limited resources during this pandemic. And finally, to highlight the incoming COVID-19 Spanish consensus manual to help care for rehabilitation patients in the Latin American regions. So now I'm going to show you the results of that investigation that we started in early March of this year, with the aim of having a map of the situation of the rehabilitation services in Latin America. We wanted to know a little bit more deeply if the rehabilitation professionals were prepared to treat the respiratory complications of these patients with COVID. So 1,012 rehabilitation professionals responded to the survey, mainly, as you can see in the graph, PMR doctors, PMR residents, speech therapists, occupational therapists, and physical therapists. Mainly all the people who worked in the front line of rehabilitation in COVID. So as you can see in the graph, the majority of the participants worked in Mexico, and this has a reason. This has to do with the fact that Mexico is the only country in Latin America that has their academic program endorsed by a national university, which is UNAM, Universidad Nacional Autónoma de México, to train physiatrists that are interested specifically in pulmonary or rehabilitation. This program is designed to prepare these physiatrists to acquire the ability to lead all these programs, specifically pulmonary rehabilitation. So in times of uncertainty, such as the ones that we are living right now, the coronavirus crisis, it is very important for healthcare systems of any country to have these professionals and to be prepared, including having appropriate specialists in managing all the needs of patients through the continuum of care. I have to say that in Latin American countries, respiratory rehabilitation is mainly guided by physical therapists. In general, when patients are in the ICU, early and respiratory rehabilitation is managed by physical therapists or physiotherapists. And this is also has to do with the fact that there's a lack of specialists in PMR in Latin America. I will talk about a little bit more about this in a minute. So we decided to start this survey after the first case report in Latin America. The World Health Organization declared the pandemic in January 30th. And the first case in Latin America was in Brazil, the 5th of February of this year. And to this day, it continues to be one of the countries with the highest number of reported cases. The Brazilian Ministry of Health reported 30,476 new cases of COVID-19 in the last 24 hours. However, the country continues with reopening measures. On March 19, Haiti became the last Latin American country to confirm the presence of COVID-19. So this information presented us with a scenario of the realities of our countries and allowed us, through the Latin American Committee on Information Management and Rehabilitation, which is CLAHIR, under the leadership of Dr. Solangel Hernandez, and AMLAR, the Latin American PMR Association that groups 21 different Latin American PMR associations, to develop a tool for rehabilitation professionals adapted to our population's needs. Well, in the meantime, we were gathering information on how COVID was affecting the rehabilitation services. This is a study that I also participated in. You can see in the graph how outpatient rehabilitation services respond. As you can see, 56% of the respondents reported that those services had been discontinued, 18% that treatment hours had been reduced, 16% that services had been discontinued but it was replaced with telemedicine, and 9% that had continued without any modifications. Of the 56% of the people who responded that those facilities were closed, We asked specifically at which point that had occurred, and 39% responded that it had happened after the first week of the first reported case in their country, 30% within the 2 weeks, and 16% after 3 weeks or more. So the question is, are we prepared for COVID-19 in Latin America in terms of protection measures, clarity in the concepts, and mental states of the professionals? Well, 81% of the professionals reported that their health center modified the care measures since the COVID-19 pandemic. 49% indicated not receiving the necessary materials for protection of medical personnel against COVID-19. 64% of the professionals consider that their medical team do not have the necessary measures to perform a timely intervention in patients with COVID-19. 69% are not clear about the recommendations on how to prescribe pulmonary physiotherapy in patients with COVID-19. 82% do not feel capable to treat patients with lung disease from COVID-19. Untreated these patients generates in the professionals anxiety in 72% of them. These are really, really scary numbers. So specifically regarding respiratory complications, we know that approximately 13% of the people with COVID-19 will have severe disease and will require hospitalization as they become short of breath. 5% will require admission to the ICU, and 75% will have evidence of bilateral pneumonia. And are we equipped in Latin America to rehabilitate respiratory complications from COVID-19? Well, 70% of professionals do not consider themselves qualified to perform pulmonary rehabilitation. 52% consider not having an interdisciplinary team capable of carrying these patients to do pulmonary rehabilitation. 66% reported not having the necessary equipment and material to provide pulmonary rehabilitation care in their workplace. So you can see these images in the bottom of the slide that are replicated in all of Latin American countries of health professionals working without the appropriate security measures. What about a unique population like spinal cord injury patients? Well, people with spinal cord injury represent a unique diagnostic challenge as it relates to coronavirus. We know that spinal cord injury patients can have different symptoms that also can mask the presentation of an acute respiratory illness, which can potentially delay the diagnosis for COVID-19. This includes temperature dysregulation, impaired cough, abnormal sensation at or below the neurological level of injury. So spinal cord injury patients with COVID-19 may not cough due to the disruption of normal respiratory physiology. We know that the ability to produce an effective cough is severely impaired in those patients with cervical or hard thoracic spinal cord injury. Respiratory manifestations of COVID-19 can be detrimental for these patients, particularly in those who have a respiratory situation or compromise. So providers taking care of spinal cord injury affected with COVID-19 should take into account that spinal cord injury symptoms can be particularly challenging. At present, there are no reports of spinal cord injury patients with COVID-19 in Latin America, but we know there are 2 cases of spinal cord injury patients with COVID-19 right now in Cuba, but we don't have all the information to share with you yet. So what happens then with respiratory rehabilitation in special populations such as people with spinal cord injuries? How do professionals feel about it? 65% do not consider themselves capable of performing pulmonary rehabilitation in spinal cord injury. 57% did not consider that they have an interdisciplinary team capable of providing pulmonary rehabilitation in these patients with spinal cord injury. And 57% did not consider they have this team, but this is a big issue for us because we know that 92% of the professionals actually expressed a desire to receiving training in pulmonary rehabilitation for these patients, specifically with spinal cord injury. So what are the needs of the rehabilitation professionals in Latin America? Rehabilitation professionals, as we saw earlier, are very open to receiving COVID-19 training and training in general of different rehabilitation issues. 94% of professionals who do not feel trained to treat patients with lung diseases from COVID are interested in receiving this training. And also 90% of the professionals who do not consider capable of performing pulmonary rehabilitation in patients, specifically in spinal cord injury, are interested in receiving this training in pulmonary rehabilitation. So this picture that you see at the bottom of the slide is a picture that we took in AMLAR's Congress in Ecuador in 2018. This is a meeting between residents and specialists. And this was a really eye-opener because after this meeting, we started to be more active and started developing some strategies to disseminate the information and training. And what barriers did we find in terms of having respiratory rehabilitation according to the needs of patients with COVID? Well, we have a lack of PMR specialists. We are around 6,000 specialists divided into 19 countries. There is a limited of countries that offer pulmonary rehabilitation, as we saw, as well as providers with this specifically expertise in perform pulmonary rehabilitations. Considering that there are approximately 0.25 and 3 PMR per 100,000 individuals on average in Latin America. There's another barrier, which is lack of training, lack of information according to the needs of Latin America, and lack of resources, of course, in our countries. So as a result of these points, how can we support professionals from institutions like AMLAR and CLAGIR? Well, we actually could only support everybody or the professionals in these 2 points, the lack of training and the lack of information according to the needs of Latin America. I really have to say that AMLAR and CLAGIR are both non-profit entities in which professionals work ad honorem. So what solutions did we come up with? Well, this platform was designed by a PMR resident, Dr. Rolando Tijerina Reyes from Mexico. The platform began to be used at the end of 2018. And from the platform and with integrated applications, we carry out all the talks and the information that we wanted to give to the rehab doctors related to COVID issues. Within this platform, it's like it's a free software. We were trying to give something for everybody to get to everybody. So it had to be something that was free. Each user can configure their profile with their names, write down their emails, write where they work, and even put their photos. The Slack platform has the advantage that it does not occupy any of the installation since it works as a web page and you can have it on your phone. It has different channels, and each channel is a chat space, a conversation channel focused on a particular topic or project. And when a new member enters, he or she will be able to see previous conversations on all of the channels. It is a function of the platform that allows you to follow conversations with other users within the same space. And you can share all kinds of files that you want just by dragging and dropping it to the web screen. And there are integrated audio and video tools for meetings and video conferences. So with this tool, we started doing a lot of video conferences, and when the pandemic started, we started to focus specifically in these issues. We had our first video conferences on March 18. That was the lecture was on coronavirus and vulnerable groups. These are the results of the video conferences. We had between 250 and 500 professionals participating in each conferences live, but they were recorded so people could see it again the next day or be available to those who couldn't see that specifically day. We had topics like COVID-19 in vulnerable groups. We have telehealth and telerehabilitation in times of COVID-19, how to optimize the immune system, among others. So at the end of March, we called out for rehabilitation professionals who would like to participate in this recommendation manual. We have a really big surprise because 54 professionals related to rehabilitation responded in 24 hours. They were physiatrists, specialists in respiratory rehabilitation, specialists in spinal cord injury, pulmonologists, PMR residents, physical therapists, psychologists, clinicians, rheumatologists, pediatricians, biological medicine specialists, and wound care specialists from all over Latin America, United States, and Spain. And this manual was compiled by CLAHIR, with the support of AMLAR and with a special chapter of residents of AMLAR, which is AMLARES. And also two societies collaborated with us in special chapters: the Spanish Society of Physical Medicine and Rehabilitation and the Argentinian Society of Wound Healing. So we divided the manual into 8 chapters. The chapters cover epidemiology of COVID-19 in Latin America, pulmonary rehabilitation in adult and pediatric patients, pulmonary rehabilitation in special populations such as spinal cord injuries, prevention for pressure ulcers in hospitalized patients in the ICUs with COVID-19, integrative medicine in the prevention and treatment of COVID-19 infection, psychosocial care and mental health based on the common principles of all disrupted situations, and the recommendations of the Spanish Society of Physical Medicine and Rehabilitation in relation to healthcare resources and benefits. So the consensus document of recommendation was made under all the working procedures of CLAHIR. The bibliographic search tools that we use included PubMed, Cochrane Library, Cochrane Iberoamerica, and Epistemónicos. This process is all detailed in the methodology chapter for the preparation of this manual recommendation. And we also used the Slack platform, that digital communication platform that I showed you before, to organize the communication, documentation, and to discuss the criteria by experts in pulmonary rehabilitation. We also had specific workshops with the aim of achieving a consensus of methodological and scientific criteria for the preparation of this manual. You see the picture with all the coordinators of the chapters and with all the team that got the information in these workshops. The manual was presented last June 23rd. And as you can see in the bottom, in the first 48 hours, it was downloaded 1,961 times. It was shared a lot on our social media, and a presentation video also was made to recognize the work of all the professionals that work on this from 24 different countries. And this shows us the need of the rehabilitation professionals in this area, and especially the concern about COVID patients. So what did we do after the publication of the manual? Well, we organized a series of video conferences with all the professionals who participated in the manual to try to bring information in a more didactic and practical way to all the professionals. We're still doing that. This one is one of the first ones. It was a transdisciplinary symposium. We have 3 specialists, 2 PMR doctors, one of them specialized in spinal cord injury, one of them in respiratory rehabilitation, and a physical therapist specialized in respiratory rehabilitation. 2 of them were in Spanish and one of them was in English. So what are our next steps? Well, we think that we must provide accessible information and equitable training. This will empower our rehab professionals, and hopefully this will translate in a better quality of life for people with disabilities. In this slide, you can see all the means that we are using to get the information to all the professionals. We have a web page, which is portalamlar.org, and every day our young editors upload a scientific article or review of different subjects related to rehabilitation. Here you can see how you can see the publications in the web page. Daily publications are carried out by AMLAR's reference residents from 20 Latin American countries. The picture that you see in the bottom is a meeting that we did last year in Argentina between Tigre and AMLAR-RES. These are some of the members. We consider it's very important to be connected, and social media brings us closer together to all of us who are interested in rehabilitation. These are all of our social media. We have Facebook, Instagram, Twitter, and more than 8,000 people related to rehabilitation are connected through our social media. All the people that you can see are getting together in our social media. This information is from our Slack platform that has been developed for AMLAR. It has 33 channels with the main topics of rehabilitation, and all the users can discuss cases, topics, and consult the leading teachers who are part of AMLAR. As you can see today, it has been increasing the number of subscribers, and today we have 1,776 subscribers on this platform. They are PMR doctors, PMR residents, physical therapists. We have all of the team members of the rehabilitation programs. This year we have 27 lectures so far. We had from teachers from Argentina, Mexico, Ecuador, Chile, Colombia, Brazil, United States, Costa Rica, Honduras, y Peru. So, in conclusion, our survey confirmed what all of us rehab providers in Latin America already suspected, that there's a lack of preparedness for a devastating event such as COVID-19 pandemic. We have a lot of work to do. We know that big challenges also create significant opportunities. Quality and accessible information for rehab providers in Latin America, of course, it's essential. There is an opportunity for our academic institutions in Latin America to improve the training of rehab providers in Latin America. And we know that knowledge is power, and that power will help us to change the reality of our countries. This is something that I also wanted to share with you. During the pandemic, we also saw demonstrations like this. You can see in the pictures, these pictures are from Argentina. You can see a doctor's car set on fire because she had COVID, or these posters that you see in the buildings of healthcare professionals where they live, and they say they are asking them to move from their homes. In Argentina, we have been in quarantine for 102 days, and it was announced that it will surely be extended until July 12th. As in the rest of the Latin American countries, our economy is really devastated, a weak economy, and it collapsed our precarious health systems and generated much anxiety in the population. That is why we also find it important to do a psychological management chapter, not only for people, also for healthcare providers who are on the front lines of the treatment of COVID. But we also saw these expressions of gratitude towards professionals, and we know that information and training must not only be for providers, but also for general population. This is the way that we will normalize attitudes of solidarity and care. It is up to us to make changes to create a better future. So these are the faces of the people who help me and collaborate with me in this presentation. And these are some of the people who worked in the consensus manual that I want to thank each one and every one of them, because this is our humble contribution to the scientific community of rehabilitation. We know that effective communication starts with listening, and that is what we did. So everyone is invited to participate. Thank you.
Thank you, Dr. Longoni. This has been an extremely stimulating and an interesting presentation. There's so many facets to it. And I would like to read a statement in the chat because I know you're probably not reading the chat while you were presenting, but this is from one member of our audience that says, I want to thank from Mexico the great work that Dr. Longoni has done in looking better academic training and knowledge sharing to care for patients appropriately. It is clear that it is necessary to continue strengthening academic preparation to be better with patients worldwide in this difficult time. Keep up the great work. Congratulations, and thank you very much for your vision and growth for all of us. So I just wanted to read that because it's obvious that there has been an extreme amount of work and energy, and obviously people are appreciating. This is from Rolando Tijerina, if I'm pronouncing it correctly. We have a question from John. It says that you noted that one limitation of your considerable efforts is that you cannot increase rehabilitation resources. It seems that government's assistance will be critical. What can EMLAR and your other organizations do to promote more government assistance?
Well, that's a very hard question. I think what we're trying to do is to show the world what we're living, and we don't have many. We cannot do very much with the government, but we can show everybody what we're doing and our reality, and because it's something that we don't have. We don't know how many patients with COVID are going to be in rehab. We don't have true statistics about disability. We need more information, and I think that gathering information is very important to give the governments the things that they need to start doing something.
I was wondering on that same line of question, Dr. Longoni, in Europe, for instance, because there's great variability among countries on how they approach different things, but one of the strategies we found helpful in the context of COVID was approaching, for instance, the European Union and the Director General for Health and Food Safety to get endorsement of some of our activities in order to have ammunition for our national government. So for instance, this was on telepractice because it's not regulated, or it's even prohibited by some European countries. I'm wondering, do you have a similar organization that could be used to help you advocate within the national government system? Are there any Latin American organizations that help regulate across countries, or is each country managing its own? Did I lose you? Hello? Can anybody else hear me?
I am sorry. My internet connection is really, really bad. This is one of the things that happen in third world countries. I'm sorry.
Okay. Did you hear my question, Meli? No?
So you were telling me something about endorsement in government endorsement in Europe and US. Is that correct?
Yeah, I was saying that, for instance, European countries, when we need to have a little bit of ammunition or help in terms of moving things forward within our country systems, we can try and advocate through the European Union on certain things. Is there a similar system in Latin America? Is there an overarching governmental or non-governmental, but sort of like a pan-Latin American organization that can help you advocate with political clout, that can help your advocacy efforts?
Well, actually, in rehabilitation, we do not. I don't know if in other countries. In Argentina, I'm certainly that there's not. I don't know if in another Latin American countries you can do this, but not in Argentina. We don't have that possibility.
Okay. We have another from our audience. It says, can you please outline the process of rehabilitation in Latin America? There are not inpatient rehab hospitals in Latin America. I think it would be important for the audience to understand the limitations.
Actually, in Latin America, we have in the ICUs, I told you before, we have mainly the work of the physical therapist. We don't have that many PMR doctors in the ICUs. So the rehabilitation is partial because you only have one member of the rehabilitation team. But then we have some inpatient hospitals in Latin America. It's not a lot of inpatient hospitals, but we do have them. And these patients, but we mostly patients in Latin America goes to outpatients rehab units, and that's actually what is going on with our rehabilitation facilities. We do have inpatient, but most people in Latin America goes through outpatient rehabilitation units. Mostly those who don't have private access to insurance. So hospitals are actually, after they are in, they go to the ICUs and they go home. And if they can do outpatient rehabilitation.
Okay, thank you. Your presentation provides an excellent example of following a process that can help build capacity, right, within a specific region. However, I can imagine that there were challenges even communicating among the professionals who were involved on this effort. And there may have been some cultural differences across countries and differences in how different countries are doing things. So what are some of the challenges that you faced in this process?
Well, it's very interesting what you're saying there, because it was exactly what happened. We were people from very different cultures, very different backgrounds. Although we were all related to rehabilitations, we did not have a lot of resources. So we have people from the US and people from Spain that didn't have the same reality that we did. And we were trying to do this manual specifically for people in Latin America because we wanted to use our real resources. So that is why we did a lot of meetings before and during the consensus, and used the platform to exchange this opinion and to try to unify our criteria. This was a very very hard work to do, but we finally got to do it, and we're very happy with the result.
Okay, thank you. John Morris is asking a question: if you can comment on the opportunities and limitations of using telehealth or internet technologies to support patients with SCI in Latin America.
Well, that's very interesting. We're trying to do that telehealth right now, especially with patients in rehabilitations, because we don't have all our facilities open. So people that had to get to rehab are not going to their center. So we're trying to use telehealth. Well, the limitations that you can see is the same that you saw right now, that sometimes our internet connection is very bad. And actually all the patients are, we have patients all over. So the other day I was commenting to one of my colleagues that I have a patient who lives like in the corner of Andes. So how can he get rehabilitation? And he was a spinal cord injury patient. So we not only have the limitations of resources, we also have the limitations of where the people live. And this is one of the things that in the project with Dr. Markali Alexander, we understood very good that it's the challenging of the climate, living in those places very far from health centers. So it's a great tool. We're using it, but it has its limitations.
Okay. Now, you mentioned something during your presentation regarding the fact that, for instance, spinal cord injury, because of the nature of the condition, sometimes symptoms of COVID might not be easily identifiable. You mentioned the temperature dysregulation, the difficulties with the productive cough, etc. What other conditions did you come across that made it more challenging for the rehabilitation community to, maybe to do earlier detection or more effective management in your experience?
Well, specifically to COVID-19, we don't have that many reports on people with previous disabilities getting COVID-19, because this was the first population that stopped going outside. got quarantined, so they were not that exposed. But I think that one of the population that's very that thing that you said is happening is actually the people in the old people. That's they don't have the same symptoms, and once it gets in homes, in nursery homes, and specifically in Latin America, we know that's a very, very high risk of getting COVID and to die from COVID. So this would be a population that we need to attend right away.
Okay. We have a comment here from Rolando Tijerina saying that telemedicine in Latin America has grown exponentially since COVID-19. Previously, we did not have a strong structure. Now we have started it in an accelerated way in most Latin American countries as something practically new. And along those lines, what were what are the attitudes in your experience of professionals in terms of using telemedicine? Do you find that people see it as an interim service delivery model because of COVID, or are you finding that people can appreciate this as a modality that can stay beyond COVID, and that there is evidence base that supports its use? What has been your experience in that? I can't hear Melly, but I don't know if people can hear me.
We can hear you, Dr. Constantini do. I think there's an intermittent problem with Dr. Longoni's line.
Okay. Let's give her a second. Dr. Longoni, can you hear us?
Yes, I can hear you. I'm so sorry.
No, it's okay. It's okay. I want to make sure you can hear us. We can be patient for a few seconds. Don't worry. So I don't know if you heard my question in regards to Rolando's comment about telemedicine. What has been your experience in terms of people's perception? Do you think it's something that are going to continue to use, or is something that people see as a temporary fix to the current pandemic?
No, I think people is going to be using telemedicine for a very long time, because it brought all of us a little bit closer, and our patients a little bit closer. For those patients who cannot go to rehabilitation facilities or to access to their healthcare centers, this is a very good option for them. So I think this will be a very good opportunity for everybody to be connected and to have what they need in terms of health and rehabilitation.
Okay. You mentioned earlier that when you ask people, are we prepared? Were we prepared for COVID? And it seems like overwhelmingly people didn't feel that they were prepared. Correct?
Yeah, that's right.
So it's interesting because that seems to be the message we're getting from across continents. Like we're watching the situation in China, and we had the benefit of weeks, right? A few weeks before it hit different parts of the world, talking about Europe and the Americas, etc. But our systems were not prepared. Hence, we also had to engage in these severe lockdown measures in some countries to be able to give our healthcare systems a way to reduce the spread of the epidemic. And so I know you're still in the midst of the epidemic, in the climax. I mean, you're still in that mode, but with all these mechanisms in place now and the capacity building you've done, do you feel that people are better prepared if we were to have a second wave? And this is also for our audience. I mean, we'd love to hear your response. Do you feel that you as a professional, you'll be better prepared if we were to have another wave in the fall? If you can just type your responses, and then Dr. Longoni, your response. We're very curious.
Well, I think so. I think we will be more prepared. Mainly because you saw that almost 72% of the people of the health providers said that they felt anxious and frightened about the situation. So I think to lower the fear by getting more information and preparedness, it's going to get us in a better place for a second wave of COVID infection.
Okay, and that's and these are encouraging thoughts then in terms of building capacity in Latin America through your work and helping the rehabilitation community to feel to manage the condition and the disease right now and the epidemic and the pandemic, and then build capacity so that you have systems in place in the unfortunate event that we were to have a second wave. Then professionals will be better prepared to manage. So I would like to thank you again for sharing your expertise and experiences, Dr. Longoni. I don't know if you have any concluding remarks.
Well, I think thank you so much for this opportunity. You know, English is not my first language, so I was trying to do my best. But thank you so much for giving us the opportunity to all of us in Latin America to give you a picture of what is going on with us. And we know in Latin America, something that we know is that we have to do a lot of prevention, because we cannot give ourselves the lecture of to have a lot of people with COVID-19, because we're not prepared. Our healthcare systems are not prepared to have that many people infected. We couldn't have the same thing that happened in Spain or the United States. If it happened in Latin America, it would be really, really disastrous. We are not. We're very far from that. So we, as professionals, have to transmit to the population that prevention and cares and all these measures, they have to do it because we cannot get everybody infected at the same time.
Sure. Well, thank you again. This has been a great presentation, and John says your English is excellent. We all agree. So thank you. Also, yes. So thanks everyone for listening. Please note that all the recordings from the webinar series are available in the next 24 to 48 hours. Please do recommend this webinar series to your colleagues. And so we conclude our episode for today. Be safe and stay healthy, everyone. And we hope to have you to join us again at the next webinar. So thank you for being here. And good afternoon or good night or good morning, depending where you are in the world.
Thank you. Goodbye.
Bye-bye.